As the cost of living continues to rise, many individuals, especially those on fixed incomes, are feeling the squeeze. But did you know that your health plan could help you save on more than just medical expenses? Well, joining us now to discuss how a dual special needs plan, or DSNP, can help is the Chief Medical Officer of Government Programs at UnitedHealthcare, Dr. Alex Billioux. Good morning, Dr. Billioux. How are you?
Good morning. I'm doing well. Thank you.
Well, good. So what is a dual special needs plan, and who qualifies for this?
So people who have Medicare and Medicaid may qualify for a dual special needs plan like our dual complete plan with UnitedHealthcare. This is a plan that's really designed to help people who have additional support needs because of income, age, or unique health needs, and really streamline their coverage and ensure that they're able to stay on top of their health. Such as, an important way we do that is many members will be eligible for $0 monthly premiums.
Okay, what kind of everyday help can a DSPN plan offer?
Well, it's important for folks to be able to have access to stuff to keep them healthy, not just medical care. So in our DSNP plans, we've also built in a monthly credit on the member's ID card, we call it the U card, that can be applied to healthy groceries at the grocery store, over-the-counter items at the pharmacy like first aid kits and toothpaste. And you can even use that monthly credit to keep your house in a normal temperature range, which I know is critical in a place like Las Vegas, with a utility credit. That's in addition to the classic things that somebody would expect from their healthcare plan. But again, we try to remove the barriers to care. So we have $0 copays for many covered prescription medications, $0 copays for annual hearing and vision tests, and no copays for virtual medical visits and mental health visits.
Yeah, there's some great additional assistance with this plan. So preventative care is also such an important factor in healthy aging. So how does a DSPN plan help people support their health as they grow older?
Yeah, absolutely. As an internist, I can tell you it's really important that people stay on top of their preventive care, go to those annual wellness visits, so that you can, make sure that you don't get sick and end up in the hospital. And so for that reason, again, we've built this plan to really reduce those barriers with $0 copays for those annual visits, as well as for mammograms and colonoscopies, and $0 copays for lab tests. We really want people to take advantage of the large nationwide Medicare Advantage network that we have, both primary care and specialty doctors, so that you can get the care you need and stay in your home healthy.
Is there a qualifying level for this plan? Who finds out whether they're eligible for it? Is there a lengthy process in applying for it? How does that process, that part of the application work?
Sure. And, it's going to vary for each person. And that's why we're really encouraging people who are interested, who think they might apply or want to know, or rather think they might be eligible and want to apply, to go to getdual.com. That's GETDUAL.com. You'll find lots of information to those questions. Where are these plans? Do you qualify? And again, you can apply directly through that site. It's important to do that right now because the open enrollment period is now through December 7th.
Yeah, one other thing I was going to say was that, typically on any healthcare plan, people don't utilize all the additional parts and factors of it. There's so many great parts to this. Is that all listed off on the website and the links?
It's definitely listed off on the website and links. And to your point, that's why we've built this into the ID card. So a lot of people, your insurance card just lives in your wallet, maybe stacked under a bunch of coupons. We want this to be a card that you really see as your health partner and that you take out when you're going to the grocery store or when you're paying that utility bill, to really use those benefits that we've built into this, as well as when you go to see your doctor and get those lab tests.
This sounds like a phenomenal plan. Dr. Billioux, thank you so much for your time this morning.
Yeah, thank you.
To learn more about dual special needs plans and to see if you qualify, head to getdual.com.